Today we're going to talk about POTS, posterior orthostatic tachycardia syndrome. So, what does POTS stand for? It stands for postural, which is related to the position of your body, orthostatic, which is a sudden drop in blood pressure, tachycardia, which is a heart rate over 100 beats per minute, and syndrome, a group of symptoms that happen together. Orthostatic intolerance. It's part of a group of orthostatic intolerances. Your heart beats faster when you go from sitting to standing. Normally, your autonomic nervous system regulates your heart rate and blood pressure in a balance, no matter what position you are in. With POTS, your body can't coordinate the balancing act of blood vessel constriction, squeezing, and heart rate response. This means that your body can't keep your blood pressure steady and stable. Risk factors include the fact that it occurs in women more than men. It occurs in 1 to 3 million in the US. People who have a significant illness like CRPS are more predisposed to having POTS. People who have had a trauma, pregnancy, people who have had surgery, and people with autoimmune diseases such as Sjögren's and celiac. Normally, when you stand up, gravity causes 10 to 15% of your blood to settle in your abdomen, legs, and arms. This means less blood reaches your brain and can cause a brief lightheadedness. If you don't have POTS, this lightheaded feeling doesn't happen often because your leg muscles help pump blood back to your heart. Normal autonomic nervous system turns on a series of rapid responses. To compensate for the lower amount of blood returning to your heart after standing, your body releases the hormone epinephrine, adrenaline, and norepinephrine. Epinephrine is both a neurotransmitter and a hormone. It plays an important role in your body's fight or flight response. It is also a medication used to treat many life-threatening conditions. Adrenaline is a hormone secreted by the adrenal glands, especially in context of stress, increasing the rate of blood circulation, breathing, and carbohydrate metabolism, and preparing muscles for exertion. Norepinephrine, also known as noradrenaline, is a neurotransmitter of the brain that plays an essential role in regulating of arousal, attention, cognitive function, and stress reactions. With people with POTS tend to pool larger amounts of blood in the blood vessels below the heart when they stand. Their body responds by releasing more norepinephrine or epinephrine to try and cause more squeezing of the blood vessels. For several reasons, their blood vessels don't respond normally to these hormones. Because their heart rate remains able to respond to the norepinephrine and epinephrine, their heart rate often increases. This imbalance can cause dizziness, fainting, or exhaustion. Symptoms of POTS include dizziness, fainting, fatigue, headaches, extreme exhaustion, bloating, feeling sick, chest pain, heart palpitations, or sleep disturbances. It is not always easy to diagnose POTS. Symptoms change over time. A tilt table is used to diagnose. a tilt table you are strapped onto and connected to monitors, and they move the table to where your head is down here. Then they bring it flat, then to a upright position. This is what the tilt table looks like. There is no cure, but things that can help are exercise and physical activities, drinking fluids frequently throughout the day. For most POTS patients, the goal is 64 to 80 ounces or 2 to 2.5 liters a day. You would also need to increase salty foods and add more salt to your diet with a salt shaker or salt tablets. Many people with CRPS and POTS infuse normal saline as an IV treatment. Normal saline is sterile salt water. Support stockings can also help prevent blood from pooling in the legs. With someone with CRPS, this may not be tolerated. So how are the two related? POTS, fibromyalgia, and CRPS all share a common feature: an abnormally behaving autonomic nervous system. In that regard, all of these conditions can be classified as a form of dysautonomia. And we will go into other dysautonomia diseases that accompany CRPS on a later show. An abnormally behaving autonomic nervous system with dystonia, which we did discuss during complications, the autonomic portion of the nervous system, the part that controls bodily functions such as skin temperature, sweating, pupil dilation, heart rate, breathing, other independent functions do not function right. Depending on how much the system is not working, a whole host of symptoms can arise. POTS and fluids. If you have POTS and require IV fluids throughout the week, you may consider getting a port. Frequent needle sticks, as such needed for a peripheral IV, have been known causes of CRPS and have been known to spread CRPS. If you need to get the IV fluids, you can go back to the ketamine show where a port is shown and how it works is explained, but I will recap it here. In the ketamine show, what the port is and how it works is explained. Frequent IV sticks can cause CRPS to spread. Many of us do not have good veins. IV fluids offer what drinking fluids cannot: a mixture of saline and sodium, reducing the need for salt pills. Peripheral IV. A peripheral IV, most clinics keep the IV in for several days since we are hard sticks. Disadvantage is that IV sticks can cause CRPS and cause spread. Possibility of phlebitis, which is inflammation of the vein, and the risk of infection. A port is a surgically implanted device that can carry fluids through to a large vessel in your body. The advantage is once that it's accessed, it can stay accessed for a week. The needle only pierces the skin, does not actually go into a vein. It goes into a little disc that is implanted under your skin. It does not have the risk of spread like peripheral IVs do. And if you get ketamine with your anesthesia during the procedure, it will lower your risk of spread. It needs to be flushed once a month, and there is the risk of infection. So, getting a port, a small incision will be made on the upper chest. The device is implanted and sutured in place, and then the catheter is put into a large vein close to the heart. This is what the port looks like before it's inserted. And the black circle in the center of the disc is where the needle goes in and then fluids infused through the catheter. Next are some photos of me flushing my own port. I first got a port back in 1999 when I was admitted for IV lidocaine infusions. Over a 24-hour period, no one could get a peripheral IV in me. So they put in a femoral line, which goes into the groin, and is a central line, and took me to the operating room to get a port. This is what the setup is that you need to access your port. There's sterile gloves. In the left-hand photo, all the way up in the left corner is the Huber needle. And in the metallic-looking container is alcohol wipes. And the plastic thing with the foam on the end is another way to clean the skin to prevent infection. So here I'm cleansing the area. Then this is what it looks like with just the needle in the center of the port. And then a sterile covering is placed over it. Now, since 1999, I've not had the same port continuously. The longest one that I've had lasted 8 years. Right now, I'm on year 6 of my current port. So it's a decision that all of us with CRPS and POTS have to make as to whether or not we can orally hydrate or need IV hydration. And if we need IV hydration, then deciding what way you want to have access to the brain, to the vein is up to you. So today we have Mary who's going to talk to us about POTS, Postural Orthostatic Tachycardia Syndrome. Which were you diagnosed with first, CRPS or POTS?
Technically POTS, but I've had symptoms of both, where both when I was younger kind of went in and out of remission.
Mm-hmm.
But when I first was officially diagnosed, I was in 4th grade and I was an altar server. My sister and I both altar servers at our local church, and it was the Stations of the Cross. We were wearing a robe and we're carrying a candle, real candle, and we're going from like station to station with the priest. And my sister noticed I started feeling sick, like I was about to pass out. My sister noticed I looked real pale, and she motioned to me, pass the candle. So I passed the candle. Then in between that, and then somehow I woke up on the bathroom floor of the church.
Wow.
I don't remember anything in between passing the candle and that.
Right.
So they said, I went to a cardiologist at CHOP, and they said, yeah, you have this POTS. And I kind of got a little better after a while. I was hydrating myself, and then it just came back around the same time as CRPS in like 7th, 8th grade, and then
Okay.
it got a little better, and then it came back. It came back after towards the end of college, and now it's been there ever since. And it got a little worse. Now it's a little better because I do the hydration twice a week. So
Do you do your hydration orally or IV?
both, both. I do the IV twice a week because it seemed no matter how many electrolytes or whatever I would drink, it would just go right
Right.
through me. It would never be
Yeah.
enough.
Right. So you just described what your early symptoms are other than fluids. Is there anything that you're doing, salt tablets, anything else that you're doing?
Some salt. I'm trying to increase my salt. I'm on a couple of medications. I've tried a lot of the medications, like the blood pressure one. The blood pressure meds dropped it too low.
Right.
blood pressure too low, and I've tried like the midterings, different ones. I had side effects. I take one called Cortilinar,
Hmm.
which is actually a heart failure med, but they found that it helps POTS. Unfortunately, a lot of insurances don't pay for it. Mine, thankfully for now, does pay, and it does help. We just went out without a couple days because the pharmacy ran out, and it was my bad because I forgot I was running low on it.
Right.
It took them a few days to order it, and I did notice a huge difference. And then I'm on
Is
this
it
Mestinon.
a beta blocker or a completely
No,
different?
I don't really know what it is. It's not a beta blocker or
Okay,
anything like that.
I'll look it up.
It's just for heart failure. And then I'm on this Mestinon, which is actually for a lot of myasthenia gravis use it.
Hmm.
And that can also help. And that seems to help too with a lot of, like, I also got a lot of leg weakness,
Right.
but I don't have myasthenia gravis. They tested me and all that.
Right. And overall, separating this from your CRPS, how has POTS changed your life?
It's made it where I would, every time I would stand, I would feel like I was going to pass out. I'm very heat intolerant, so I have to be very careful, especially in the summer. I
Right.
live in New Jersey, so it's not like we do
Not
get
like in
four
Florida.
seasons. Yeah, it's not like in Florida where it's like summer year round. But I
Yeah.
have to be very careful outside. I have to hydrate all the time. I can't let myself forget to hydrate. Like if I'm out somewhere, I have to bring drinks with me and
Right.
or buy drinks and make sure like it doesn't matter what the cost is.
You got to
My
constantly
health is
be
more important. And
drinking.
then the health with the hydration, it's kind of annoying because it kind of makes it hard to travel.
Yeah.
Because I get it twice a week. It's just whatever 2 days I can. So like you have to either like luckily we have a house in Cape Cod and I found made arrangements up there that
Do
they'll
you
take
have a
me in.
port or are you getting a
Yes, I
port
do have
by?
a port.
Okay.
I have a port. I got that a few months, like 6 months in.
Okay. All right. Well, thank you so much for sharing your experience. This is something I was just diagnosed with 28 years into CRPS. So
Yeah, it doesn't
I'm still
surprise me.
making the
It's another one
adjustments.
of those things like CRPS that needs more awareness.
Yeah, it does. Fortunately, the cardiologist that I'd been seeing over the years knew what it was and pretty much said, okay, this is what we've got to do. Well,
Yeah,
thank you
I
so
saw I
much.
had to switch cardiologists and I finally found one that really is very knowledgeable about it. So,
Yeah, yeah. Well, thank you so much.
yep.